So one of the newer services that we have offered through Advanced Revenue Cycle Management is contracting and credentialing. And when we talk about contracting, we talk about payer contracting, and we talk about credentialing for practitioners, providers, physicians, nurse practitioners. So it's two facets of the same component basically, and it applies to different services. So contracting, payer contracting, we provide for home health, hospice, and palliative care programs. And that is really about getting those providers in network with any particular payer that they would like to be an in-network participant for. The challenge is, of course, that some of those payers have closed networks, and sometimes that is geographically based. You know, a provider may be open in Texas, but it might be closed in another state. So it's really challenging to try to get those providers in the networks they want to participate in, because a lot of those plans have parameters that, you know, they're not accepting certain provider types, they're not allowing new participants. And then on the credentialing side, that is another layer of contracting. So in palliative especially, we see this where those are professional services, right? So we may have a contract for the program may be contracted with a particular payer, but every provider, which is the physicians, the nurse practitioners, they also have to be credentialed in that same payer program. So it's layered, right? So as a practice, you have to be in network, and then as a provider, you have to be recognized as credentialed within that network. So it's a little bit of a double layer for those professional providers, and so we are assisting with those contracts. It's very in-depth, challenging. Some payers are pretty simple and straightforward, and others are very complex. So we have a team of contracting and credentialing specialists who assist our providers in whatever type of service they provide and get them in network so that they have the best terms and hopefully the best payment for the services they provide.